Picture this. You go to your doctor for your annual physical. You get your blood work done, and your doctor tells you your cholesterol is normal. You walk out feeling great, thinking you're protected. But right now, there could be a force inside your body that could be slowly stiffening your arteries, and you can't even feel it. In fact, 50% of heart attacks happen to people with normal cholesterol levels. Today, I'm going to give you the exact script to use with your primary care doctor to uncover your true risk. I'm Dr. Dabhadkar, a board-certified preventive cardiologist. I've spent 15 years helping busy professionals prevent heart disease, and I'm going to show you the 3 specific tests every man over 40 must ask for this year. If you're over 40 and you have a family history of heart disease, relying on a standard lipid panel is like trying to drive a car while looking through a keyhole. The standard tests are archaic. They miss the hidden drivers of atherosclerosis. So in this video, we're going to look at 3 advanced metrics: ApoB, lipoprotein A, and the coronary artery calcium score. I'll explain what they are, why your doctor probably hasn't ordered them, and what to do when you get the results. Now, before we dive into the first test, I want to make sure you have the tools to actually use this information. I put together a free guide called Optimal. It covers the full framework my patients use to protect their hearts and understand their labs. It is in the description below. Grab it now and let's get into the tests. The first test you need to ask for is apolipoprotein B or ApoB. Most doctors look at your LDL cholesterol, which is the total volume of cholesterol in your blood that is bound to LDL particles. But volume isn't the whole story. Imagine a highway. LDL is the total weight of the cargo on the road. ApoB tells you the actual number of vehicles carrying that cargo. Why does this matter? Because it is the number of the particles themselves that crash into your artery walls and cause plaque buildup. You can have a normal LDL volume, but if you have a high number of small, dense ApoB particles, your risk of heart attack is significantly higher. In my clinic, if a patient has any detectable plaque, normal is no longer the target. We want to see the ApoB driven down as low as physiologically possible. So ApoB tells us how many dangerous particles are in your blood. But what if you're doing everything right, eating perfectly, exercising daily, and your risk is still sky high because of something you inherited? That brings us to the second test, which most doctors unfortunately never check. The second test is lipoprotein A, pronounced Lp(a). This is a highly dangerous, sticky cholesterol particle. It doesn't just cause plaque buildup. It also promotes inflammation and blood clots. Here is the terrifying part. Your Lp(a) level is almost entirely determined by your genetics. Diet and exercise will not lower it. About 1 in 5 people worldwide have elevated Lp(a), and it is a massive driver of premature heart attacks in people who otherwise look perfectly healthy. Current guidelines recommend that every adult get tested for Lp(a) at least once in their lifetime. If your level is over 125 nanomoles per liter or 50 milligrams per deciliter, your risk of heart disease and stroke is significantly increased. Blood tests like ApoB and Lp(a) tell us the story of what is floating in your blood. But blood tests are just probabilities. They tell us what might happen. But how do we know what is actually happening inside your arteries right now? That is test number 3. The third test is not a blood test at all. It is a CT scan. It is called a coronary artery calcium scan, or a CAC score. This is a very simple 10-minute non-invasive CT scan of your heart. It looks directly at your coronary arteries to see if there are any calcified plaque deposits. Think of it this way. Blood tests predict the weather. A CAC scan looks out the window to see if it is already raining. A A score of 0 means you have no calcified plaque and your risk of a heart attack in the next 10 years is incredibly low. But if your score is above 0, it means the disease process has already started and you need to act urgently. Nowadays, we also used another CT scan called CT coronary angiography to see exactly what is happening inside your vessel walls. If you're over 40, especially with a family history, a CAC scan is the ultimate tiebreaker to decide if you need aggressive medical therapy like a statin. So to recap, ask your doctor for an ApoB test, an LPA test, and a coronary artery calcium scan. If you're a busy professional, you probably don't have time to guess which labs you need, which tests you need to do. You're probably making decisions based on an outdated cholesterol panel. You need a targeted evidence-based plan based on your unique advanced labs and tests. That is exactly what I do in my practice. So if you want to stop guessing and start optimizing your heart health, click the link in the description to download my free optimal guide to get started. Or if you want to learn more about keeping a healthy heart, click this video on the screen where I cover the top 10 foods for heart health. I'll see you in the next video.